Don't get hit with Medicare penalties. Easy tips to stay penalty-free. Hi everyone, welcome back to Café Medicare, where we simplify everything Medicare for you. I'm Brittany, a licensed health agent with over 10 years of experience in the Medicare field. Today we're diving into a crucial topic: Medicare penalties. Managing your Medicare correctly is essential to avoid unnecessary costs and stress. In this video, we will explore the different types of Medicare penalties and, most importantly, how you can avoid them. Stick around to get all the tips you need to remain penalty-free. Medicare penalties can be a serious issue for many beneficiaries, and they come in several forms. Let's break down the most common types. Late enrollment penalty for Part B. If you don't sign up for Part B when you're first eligible, you might have to pay a late enrollment penalty for as long as you have Part B. This penalty increases your monthly premium by 10% for each full 12-month period you could have had Part B but didn't sign up. So if you delayed for 2 years, that's a 20% increase on your premium. And this increase sticks with you for life. An exception to the penalty would be employer coverage. The employer coverage must be considered creditable, and you will require documentation from your employer once you are ready to enroll in Part B. Part D, late enrollment penalty. This penalty applies if you go without Part D or other credible prescription drug coverage for 63 consecutive days or more after your initial enrollment period is over. The penalty is calculated based on the number of months you didn't have coverage. For example, if you went 10 months without coverage, the penalty would be 1% of the national base beneficiary premium multiplied by 10, then added to your monthly premium. This is a lifelong penalty. An exception to the penalty would be employer coverage. The employer coverage must be considered creditable, and you will require documentation from your employer once you are ready to enroll in Part D. Another exception is having Medicaid or Extra Help low-income subsidy. These programs will waive the penalty, but if you lose these benefits, the penalty will apply. Medicare Advantage, disenrollment penalty. Switching from a Medicare Advantage plan back to original Medicare without enrolling into a standalone prescription drug plan can lead to penalties or loss of coverage. If you drop or lose prescription drug coverage for more than 63 days, regardless of your transition, change in coverage will put you at subject for a penalty. This can be particularly tricky if you're not aware of the specific enrollment windows, such as the annual enrollment period or special enrollment periods. Common reasons for these penalties include lack of awareness, confusion about enrollment periods, and misunderstanding the coverage options available. It's easy to see how missing a deadline or misunderstanding a rule can lead to costly penalties that stick with you for the long term. Now that we know what the penalties are, let's talk about how to avoid them. Here are some actionable steps. 1. Enroll on time. The best way to avoid penalties is to enroll during your initial enrollment period, which starts 3 months before you turn 65 and ends 3 months after. Mark your calendar and make sure you're aware of your IEP dates. Missing this window can lead to penalties that will cost you more in the long run. Understand your coverage options. Take the time to research and understand the different parts of Medicare: Part A, Part B, Part C, Medicare Advantage, and Part D, prescription drug plans. Each part has its own rules and enrollment periods. Knowing what each part covers and the associated timelines will help you make informed decisions and avoid gaps in coverage. Sign up for Part B. Even if you're still working and have employer coverage, consider signing up for Part B when you're first eligible to avoid future penalties, unless your employer has 20 or more employees, which might provide you with a special enrollment period, SEP, later on. This SEP gives you a 3-month window to sign up for Part B, a Medicare Advantage plan, and a prescription drug plan without facing penalties after your employer coverage ends. For supplement plans, you will have a 6-month guaranteed issue window. Maintain creditable drug coverage. Ensure your prescription drug coverage is considered creditable by Medicare standards to avoid the Part D penalty. If you have drug coverage through an employer or union, confirm that it's creditable. Your provider should send you a notice every year confirming whether your coverage is creditable. Keep this notice as proof to avoid penalties. Take advantage of special enrollment periods. If you're working past 65 and have employer coverage, you might qualify for a special enrollment period when you retire. This allows you to enroll in Medicare without penalties. However, make sure you enroll promptly once your employer coverage ends. Missing this special enrollment period can lead to penalties that are otherwise avoidable. Seek professional help. Medicare can be complex, and sometimes it's worth getting advice from a licensed health agent. They can help you navigate the enrollment process and ensure you meet all deadlines. Agents are knowledgeable about the intricacies of Medicare and can provide personalized advice based on your unique situation. Additionally, staying informed through reliable sources can be invaluable. For instance, the official Medicare website, medicare.gov, provides a wealth of information and resources. Make use of online tools and resources to stay updated on any changes in Medicare policies and deadlines. Let's hear some success stories of people who navigated Medicare successfully without incurring any penalties. Meet Jane. She turned 65 last year and was still working. Jane watched our videos and knew she had to understand her options. She enrolled in Part B during her initial enrollment period, even though she had employer coverage. When she retired, she had a seamless transition into Medicare without any penalties because she was well informed and took action at the right times. Jane's story highlights the importance of staying informed and taking proactive steps, even if you think you have adequate coverage through your employer. Then there's Mark. He was confused about whether his prescription drug plan was creditable. He consulted with a licensed health agent and discovered that his coverage was not creditable. Mark promptly enrolled in a Part D plan during the annual enrollment period, avoiding any late enrollment penalties. His quick action and willingness to seek professional advice saved him from additional costs that could have added up over time. These stories highlight the importance of being proactive and informed. In summary, avoiding Medicare penalties comes down to timely enrollment, understanding your coverage options, and staying informed about your benefits. Remember to mark your initial enrollment period on your calendar. Review your coverage options carefully, and consult a licensed health agent if you're unsure about any aspect of your Medicare plan. Taking these steps can save you a lot of money and hassle in the long run. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe to Café Medicare for more valuable tips. Have any questions or personal experiences with Medicare penalties? Drop them in the comments below. We'd love to hear from you and help you out. Stay informed and stay penalty-free. Subscribe to Café Medicare new videos every week to help you navigate Medicare easily.